Bonjour tout le monde, bienvenue dans ce petit webinaire très important présenté par Dr. Kavneski, I3M, Integrative Institute, International Institute for Integrative Health Medicine, actually, I3M, Integrative Institute, International Integrative Institute of Medicine. Michael, je vais te laisser le redire comme il faut, je m'excuse. I3M, Institut international en médecine intégrative. En français, c'est ça. On va présenter c'est quoi la certification aujourd'hui avec Michael, qui est le créateur de la certification, qui va être présentée au Congrès de la santé intégrative les 29, 30, 31 janvier 2026. Les gens qui s'inscrivent à la certification ont aussi accès à l'ensemble des conférences du Congrès. Donc, c'est une question qu'on se fait souvent poser. La majorité de la certification va aussi se donner en anglais, mais va être traduite en direct dans le langage de votre choix. Que ce soit en français, que ce soit en espagnol, que ce soit en chinois, vous pourrez le directement lors de l'événement, autant en virtuel qu'en présentiel, parce que oui, ça va être accessible aussi en virtuel, euh, l'écouter dans la langue de votre choix. Sans plus tarder, je laisse la parole à Michael qui va nous définir qu'est-ce que la certification. So, Michael, please share your screen full screen and let us know what is waiting for us in the next month, and years to come with the certification.
Perfect. Thank you for such a great intro. And I am going to share my screen here. Let's see. I have permission to share my screen.
You
Yes.
should.
Let's see. Well, in the meantime, I will quickly, if you don't mind giving me some permission to share my screen, let me know when I have it. I will quickly say hi to everybody. I'm an integrative medicine doc in Montreal, originally from New York. Really excited to partner with JC and PO here in Montreal. Merci tout le monde pour être ici. Gracias por toda la gente para estar aquí. We are excited that this will be the first truly international version of this beautiful integrative health congress that JCNPO have produced several years now with upwards of about 1,000 attendees. This will be the first year where we're partnering with the Academy of Integrative Health and Medicine in the States. We're excited to feature Hélène Langevin as our keynote speaker, who is the director of the NIH Center for Integrative Medicine and Whole Person Care. And I am
You
looking,
should be able to share your screen, Michael.
I am seeing share. That's wonderful. So today the goal is to learn a little bit more about what this idea of becoming a diplomat in whole person care and wellness medicine means, and how we're going to be featuring this at the upcoming Integrative Health Conference this coming January. So what's exciting, as many of you have experienced in the past at integrative medical or health conferences, is that while there's wonderful lectures, wonderful people, wonderful experiences, sometimes we like to have a training that we can really hang our hat on, in the sense where we say, I accomplished this, I'm certified in this, I can offer my patients this, and we can move on to the next level. We base the way we've created this training on several things. First and foremost, it's based in evidence-based integrative medicine, whole person care, which is an interesting new brand of the idea of integrative medicine, which we are embracing wholeheartedly, pun intended. The idea of wellness medicine, longevity medicine, functional medicine, personalized medicine, all of these are different terms that, quite frankly, mean we take care of the whole individual in their environment with all of the factors that are causing whatever the pathology is, with a focus on health and wellness. And we do this in an integrated team. So today I'm going to go into a little bit about what this first 12 hours at this upcoming conference is going to be about. It's a level one certification. The idea is that if we finish all three levels, if that should be of interest to you, you should be able to be a diplomat of evidence-based integrative and myofascial medicine, whole person care, and you should feel comfortable at least navigating the wild west of what is holistic medicine out there. So why are we doing this? And here you'll see French and English, and in prior iterations, we've subjected individuals to my mauvaise franglais, donc on va pas faire ça aujourd'hui. But for the conference, we will have French transcription at the bottom, and the slides will be bilingual. And in the future, as JC said, we look to be fully international, having Spanish and whatever language you need transcribed. But I think we all know that we have a crisis in modern medicine. And the truth is, you can pick your crisis, whether it's localized to Quebec, North America, the global South, the global North. But the one I'm talking about is that we have a rising tide of complex chronic diseases. And most of them are caused because of our lifestyle and our environment. And we know that in conventional medicine, acute care, whether it's my intensive care unit or whether it's the emergency room, we can handle most acute things. But we're not good in conventional medicine at dealing with the root cause. So most chronic diseases, conditions, symptoms, pathologies are not being handled well in conventional medicine. And we know that in integrative medicine, health, acupuncture, naturopathy, yoga, insert a whole list of our non-MD colleagues that are excellent at their specialties. They handle it much, much better. So as an integrative doc, as a clinician in whatever your field is, the goal is to give you as many tools and skill sets to be able to navigate both sides of the fence. Whether it's for physicians, we haven't learned how to use our hands if we're MDs, if we're allopaths. If you have, excuse me, that's wonderful. Our osteopath colleagues usually have. Our myofascial colleagues definitely have. But at the same time, we're trying to really bridge this gap between conventional medicine and the integrative modalities, because there's often both sides look at each other as though they're the enemy, and that's not the case. So the other big issue that we're experiencing across all modalities is physician, clinician, healer burnout. And this is actually causing us to not be able to heal our patients the way they deserve to get healed. So the idea behind creating an environment and educational infrastructure and working with JCPO and our academic partners to create a course that's both didactic, meaning sitting, learning in lectures, whether you're there in person, whether you're there online, and experiential. There will be hands-on elements, which I will get to. The idea is it helps you heal and it helps you become a better healer. So we know that there's silos in conventional medicine. There's the cardiologist, there's the dermatologist, there's the left pinky toeologist, and then there's also the X-ray software, the lab software, the health record software. Nobody talks to anybody. But what's interesting is that in integrative medicine, we're also guilty. Okay. We also have silos. We have the acute care silo, where, for example, my critical care colleagues, excellent in extreme physiology, we don't have a chance to get into lifestyle intervention. When I've intubated somebody in my intensive care unit, I'm not thinking about talking about colonoscopies, mammographies, pap smears. That's not the priority. And oftentimes it just falls away and it never gets transferred in transition. But in functional medicine, we're phenomenal at the biochemical nuance. Which fancy lab test, which fancy supplement, but we're not thinking so much about structural pathologies. And in manual therapy, we understand tissue texture. We can palpate a hypertonic insertion of a myofascial infrastructure. We can see where there's a spasm. We can needle that spot until it releases, but we may be overlooking metabolic pain drivers. We need physicians, clinicians, healers that can at least be fluent in all these languages. The goal of this course is not to make you an expert in all of these things. Of course, that would be exciting. And there will be elements where we can expand those knowledge areas. But the idea is to at least fill in the gaps, to have a solid foundation, whereas integrative whole person care providers, we don't lack a whole idea about how humans function. So what we've tried to do by creating this course is that we can guide our patients from an intensive care unit literally to the yoga mat, if you'll allow the cheesy mental image. Okay. And the idea is by creating providers, by bringing knowledge to you in a way where you can make sure that they have acute safety for their acute care needs, where you understand the basics of functional system biology, and we look forward to helping you understand what's really the cutting edge of myofascial medicine. So what you're gonna be able to do is you're gonna be able to take your patients beyond the disease, beyond the symptom management, to really feel like you're giving them optimal vitality. So as I mentioned, we set up this course, the diplomat certification, to have 3 levels. So our first level is going to be at the Integrative Health Congress in Montreal, both online and in person. It's a 3-day intensive training. There's going to be 9 hours of didactics, okay, and 3 hours of hands-on care. It's structured similarly to courses out of Harvard for structural acupuncture for physicians. Those are, of course, a year-long course. Functional medicine courses that Mark Hyman and the great team at the Functional Medicine Institute have created. But the idea is to really give you that experience in this setting within 12 hours that are also continuing medical education eligible, or FCO eligible. Okay, so when you walk out of this course after these 3 days, you should feel like you understand the foundations of whole person care, the foundations of evidence-based integrative medicine, functional medicine, and how to apply the most basic elements in your care with your patients, as well as getting a taste for the deep dive, the next level. So in the next level, we have some advanced system certifications that are very specific and necessary. And again, we're going to learn more about this when you do the level 1. But we're talking about the gastroenterologic system, the neurologic system, the cardiometabolic system, as well as immunology and inflammatory tracts. Now, there will be some electives for level 2, people who want to learn more myofascial medicine, people who want to learn more executive health and occupational health. Those will be electives. And then the third level really is where you're able to show clinical mastery. So we do have a board exam. You're going to have a mentor assigned to you, and you're going to spend a year under the guidance of a mentor, where you're going to be presenting cases, 12 cases that are specific to demonstrating your understanding and knowledge of the full foundations of whole person care. So, as I mentioned, this first 3-day live intensive, it's going to be 12 CME eligible credits, so you can write it off on your taxes, you can get credit for it, and also, let's see, thank you for doing that. And who is eligible to join? Anybody who's a clinician in the diverse world of integrative, whole person care, functional medicine, MDs, DOs, physiotherapists, kinesiotherapists, nurses, nutritionists, acupuncturists, yogis. I know I'm missing quite a few individuals, but the idea is that during this incredible Integrative Health Congress, you can also get continuing medical education credits while also getting these skills that we've been talking about. So there's a bit of detail on the actual curriculum. We're going to be going through what the history of integrative medicine is. How do we appraise the evidence of what we call the hierarchy of harm versus benefit in integrative medicine? And then what does it mean to have a whole person care approach? And we all like to have that quick, uh, give me something I can apply to my patients tomorrow. So we're going to be talking about the top pathologies, conditions, diagnostics that most of us see in our practice, and what are some approaches, both from an integrative, functional medicine, whole person care, and myofascial medicine background that you can apply. So the idea is for you to walk out with a toolkit. More tools than a spice rack and spices that you can apply. We really want you to be able to make a difference the day after this conference. And I think what's important is that just like in Andrew Weil's courses for integrative medicine out of Arizona and lots of the fellowships out there, we're not going to become experts in every type of modality, but at least you should know about it. You should know the evidence about it, and you should be able to direct your patients to certified, credentialed, evidence-based practitioners. Because a lot of the times, our patients are coming to us and saying, hey, I have this, I need to see this. And our job is to help educate them, help empower them, and help bring them to the right colleague of ours who may have a skill set that we don't offer our patients. So, similarly, in functional medicine, there are key elements like this idea of mitochondrial dysfunction that are going to be very important. There's key elements to the gut-brain axis, microbiome science, inflammatory and communicating elements to the gut-brain axis that we want to know about. We're going to be talking about stress physiology, sleep optimization, burnout prevention, not just for our patients, but for ourselves as healers, right? We have to heal the healer. And we're going to talk about mental health, this idea of neuroinflammatory state, nutritional psychiatry, and cognitive optimization as well. So one piece that may seem a little unique to a lot of individuals participating is why myofascial medicine and why are we including that as a foundational element? Well, our body is not held up by bones; it's held up by fascia. And those of you that know me, that have heard me talk about this, feel free to 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 have a sip of coffee for 30 seconds because you've heard me uh, absolutely obsess and geek about the fact that our fascia is not just an infrastructural system, it's a neuroendocrine communicating matrix. It's our body's Eiffel Tower as well as our body's fiber optic network. And we know that our body is set up to have this living matrix, this idea that we're calling this neurofascial model, okay, of communication that really is represented in most pathologies. So this idea of having a structural component to pathology represented by our fascia as the communicating organ is a very exciting part of the longitudinal education that we're going to be giving. And it's, of course, based on evidence and excellent research from Dr. Langevin, who, as I mentioned, is our keynote speaker, and individuals such as Dr. Schleip, Myers, quite a few gurus in the fascia field. And we're going to give you some hands-on experience with myofascial medicine, especially for us MDs who've never learned to palpate, which many of us have not. And we're spending tons of effort, energy, and money treating our patient's pain or evaluating our patient's pain, where if we only knew how to put our hands on our patients and palpate and evaluate them, we could actually help them that moment, that visit, and not send them elsewhere for imaging that may or may not actually make a difference, which is a very nice thing to be able to offer our patients. So, as I mentioned, the structure of the workshops, there's going to be three workshops. There's going to be a basic myofascial medicine workshop where you're going to learn how to palpate. And those of you who are already myofascial medicine practitioners, we're going to be giving you some very interesting approaches you can use, again, same day, to augment your already powerful myofascial medicine skills. Then the second hands-on workshop, we're going to be getting more into detail about specific techniques. First day will be lower back, ventilatory, meaning breathing techniques. And then the second day, we're going to be having more cervical techniques. And then the third day, we're going to talk about focal pain and extremities. So the goal of these workshops are just like the didactic lectures, that you're able to walk out the next day and start to be able to take care, evaluate, and treat your patients in a way you haven't treated them before with your hands and helping their pain, whether it's back pain, neck pain, shoulder pain, knee pain, hip pain. We're not going to be experts when we leave, but we will have an expert perspective on how we can be helping. So some additional fun talks that we're going to be doing. We're going to talk about occupational health, hormonal health. We're going to apply this idea of that sports medicine uses for executive health as well as workforce wellness and injury prevention. There's a lot of integrative medicine and myofascial medicine in the workplace. So we want to be able to give you guys at least the tools to start thinking about how to incorporate it from a business model perspective in your practice. This is a good direction to start to incorporate that those individuals and those potential revenue streams. And we spend a third of our life at work, right? Most people. So we should be doing some healing at work as well. And then there's this big push with women's hormones, men's hormones, the GLPs. So we're going to be talking a lot about some basic integrative functional medicine, hormone medicine. But at the same time, we want to give you some of these tools for you to use in your practice. So, and one of our favorite fun topics is going to be innovations. So, what are the innovations in evidence-based medicine that we're starting to use in integrative functional medicine, whole person care? We're going to get into a lot of the ones that you see listed here, whether it's actual PRP, stem cells, or technologies like virtual reality, digital technologies. We're going to touch on AI, robotics, magnetic field. And we want you to be able to have at least a handful of innovations that are, as we say in French, I love this term, that are not poudre de le perlimpinpin, that are not snake oil. Okay. And we want to be able to give you the evidence because, again, it's good for us to have options. Not every patient responds to the same approach. So you need to have different recipes in your cookbook for the same meal. So, what are some important parts about how every good education experience has to be structured? For us, patient safety is key. Okay, so the guidelines we use to structure our curriculum are based on conventional medical guidelines from critical care, hospital medicine, family medicine, as well as integrative medicine, of course. We are big fans of the Functional Medicine Institute biochemical individuality concept, so this has to be applied. The Fascia Research Congress does a great job outlining what we need to know from a structural competence standpoint. How does the fascia actually support and communicate within our body? And this idea of a humanistic approach from whole person care and evidence-based wellness is quite frankly the thread that connects everything on a very spiritual level. So we do look forward to seeing you in January, whether it's virtually or in person. If you're in person, you can do all 12 hours. If you participate virtually, you'll get the 9 hours, and then you can show up at one of our upcoming seminars that I'll let JC tell you about, where you can actually get those 3 hours of manual therapy certification, and we can get more into the next levels as we discussed. And I think what you can expect is that you are going to be a provider, a clinician, a healer that is able to impact your patients in a way that most around you don't. That you will feel refreshed and rejuvenated in your practice. I find it incredibly rewarding to be able to take away a patient's pain in the 20 minutes that they're with me. It feels almost like magic, and it's not magic. It's, as my daughters will say, it's fascia. But this is knowledge that we're excited to share, and we have an amazing team that's looking forward to teaching you this. And as far as the integrative medicine, the functional medicine, the whole person care, um, these things aren't optional. I mean, if you're participating in this webinar, quite frankly, I'm probably preaching to the choir. And you know this, right? So it's our colleagues that aren't here that should be. But I think the most powerful thing, especially these days, that I hope that you get is that you start to feel a joy in your practice, that you feel healed, that you feel excited to go to work. Because things are crazy out there these days, and these moments when I get to be with you, when we get to be together with amazing healers like yourselves, everybody on this Zoom, the LinkedIn, the Facebook, even with our technical difficulties, this healing energy is why we started our journey 10, 20, 30, 40, however many years ago. So we need to keep that spark going. So I already talked about who this is for. I think enough about me, but I'm excited for you guys to be joining this January. And thank you.
Great. Thank you very much, Michael. It's we're so lucky to have you to put this together. We're really looking forward to have the first step at the Congress, the 29th. So for people asking, who knows the Congress, the Integrative Health Congress that it's going to happen at the end of January, there's the 30th and the 31st, which is the Congress, but the certification starts on the 29th. So it's the 29th, the 30th, the 31st. So when you buy the certification, obviously you have access to the certification, but also all the Congress. I got a couple quick question resume for you, Michael, for what you've covered. First thing is how many um, steps is there into the certification?
Sure. So there's three levels. There's the first level, which we're going to be doing at the conference, which is 12 hours of CME eligible, continuing medicine eligible, depending on whether you're a physician, nurse, physio, kinesio, nutritionist. Everybody knows their order and what they require. And that's one of the benefits of working with partner organizations to be able to make sure that we're fitting those criteria. The second level, we're going to be launching in the spring. So basically, in May, you can expect to start the second level. And there's going to be several mandatory tracks, which are the organ system tracks, similar to some existing models out there in functional medicine and in integrative medicine. But the idea is for all of these to be smaller, bite-sized. 12 hours is the longest level, the first level. Each of those other, whether it's the gastrointestinal, the cardiometabolic, the neuroimmune, those are 6 to 8 hours in terms of each mandatory one, and those are going to be only online. You're, of course, welcome to join at any one of the conferences that we're at for the myofascial hands-on component. And then the third level is a 12-month. So the shortest you can do this in is about 2 years. Okay, but the idea is that it's not hundreds or thousands of hours. We have amazing partners like the AIHM or other organizations that have really in-depth certifications and fellowships where the idea is once you have this foundation, you can go further and deeper. But a lot of us in the professional world, we only have a couple hours here or there. So that's really what this is designed for. But we also want to make sure that if you're out there saying you're a diplomat of whole person care, that you're certified in evidence-based integrative and myofascial medicine, that we've given you the skill sets so that you can take care of your patients, so that the patients can feel safe, so that they know they're in the hands of a good provider. And that's why it's really nice to be able to do this in partnership with JCPO, the Human 360 group, the NIH, and have keynotes like Hélène Langevin. And I see some of our colleagues from AIHM have joined. So we're really grateful to them for their support as well.
Yep, and I just want to add one thing is obviously at the Congress there will be the practical part that will be given. If people can only want to see it virtual live, obviously they can access to that, and there will be the practical part, the hands-on body part later in the year. We're gonna announce more date at the Congress because we're working on the schedule right now. We already know there's gonna be some place in May that's gonna be available here in Quebec and probably with partners in the States also. And we're even talking to. It's gonna be worldwide, so we're gonna go overseas also to give that on end part in the next year. We're gonna announce it a little bit later. So, but people can buy it online and come at the event and watch it live, virtual live. But obviously, the best part is to come and live the real thing with the real hand on the people at the Congress. Um, and you said it, but I just want to point it out because I think it's super important. For who is that certification?
Yeah, so if you are on this call, it's for you. I feel like the pillow guy. It's for you. No, but it's for anybody who would attend one of these amazing, beautiful events that you guys have coordinated, whether it's an AIHM member, whether it's a Human 360 member, whether it's an APSI member. But basically, nurses, nutritionists, acupuncturists, yoga therapists, physios, kinesios, chiropractors, osteopaths, homeopaths, uh, MDs, DOs. I'm sure I've missed an acronym or seven out there. And I would say that even at some of our conferences, I've come across, I'm going to use the word civilian jokingly, but individuals who care enough about their own health and feel like healers in their community, but they may not have had formal medical education. Okay. Um, there's no reason they can't participate. Granted, they may not have an organization to go to get the eligible credits, and we're always going to focus on making sure that our patients feel safe, and we have to represent ourselves carefully and correctly to our patients. But it's for everybody who works as a healer.
Absolutely. And so people don't want to come to that first worldwide event. So it's really a first in Canada, North America, that certification. So the places are limited to be present at the Congress. So we got 150 place. So share the news. It's a great gift for Christmas. Share the news. Reserve as soon as possible so you get your spot, you get your hotel room and everything. Because yeah, we can have as much people online as we can. But for the people be present at the Congress, there's limited place. So just try not to wait the last minute to make sure you got your spot. That's pretty much what I say. Just to end up, Michael, maybe just a review of why and how did you come to put together that certification?
Sure. Thank you. Well, first of all, it's based on my journey in almost 30 years ago when I decided I was going to go into medicine. I saw who was the captain of the ship. And I saw that the patriarchal MDs were captaining a ship that, while intentions may have been good, it was missing this whole world of holism with both a W and an H. And uh, conventional medicine does many great, beautiful things, critical care, hospital care, family medicine. But at the same time, this journey led me to really appreciate that we're missing the whole manual therapy experience. And also in functional medicine, in wellness medicine, there are elements that are just each silo, even in the integrative world, is not as connected as it could be. And being able to share both the teaching I've done and that other other members on our teaching team have done in one infrastructure, in one course that's bite-sized, that's tangible, that gives you a certification. You're able to walk out of there saying, I learned this, I can apply this tomorrow. That's been the motivation for creating this course.
Well, again, thank you very much. It's well needed because as we say often, integrative health is part of the solution, a big part of the solution of what we're living right now, whether it's with our health and our system, pretty much anywhere you are in the world right now. So integrative health is part of that solution and creating something more specific. Same thing with what AIHM does in the state. We're going to have people from overseas also that's going to demonstrate how they do it overseas. But I think that the forces come when we're all together. And I think having something that is, again, you said chewable, easy to integrate into our practice, into our formation, is really great. So we are really, really, really happy again to be able to showcase, present that certification at our event. It's a real pleasure. It's a real honor. So again, people share the good news because we're making health moving forward. We're making health care moving forward. And big thanks to you, Michael.
Thank you to all of you for the warm welcome, and I look forward to learning with you.
So everybody, keep listening to us, keep following us to know more, and share the good news of the event that is upcoming.